vous joindre à ce point de presse au sujet du nouveau coronavirus COVID-19. Before we en haut à la droite de l'écran. Reporters with accessibility needs can pin the interpreters or follow along on the YouTube stream. Les journalistes ayant des besoins en matière d'accessibilité peuvent avoir recours aux interprètes ou suivre la diffusion en direct sur YouTube. Today, we'll be hearing remarks from Dr. Vera, Chief Medical Officer of the Ottawa Public Health. Notre porte-parole aujourd'hui est la Dr. Vera, médecin en chef de Santé publique Ottawa. Je passe maintenant la parole au médecin en chef de Santé publique. Please go ahead, Dr. Etches.
Merci, bonjour, everyone. It is hard to believe that it's been 6 months since we first announced the first individual who had tested positive for COVID-19 in our community. And the fear that was there about contracting the virus when going out has been countered with evidence that if we do our physical distancing, wearing a mask, washing our hands, staying home when we're sick, we're very unlikely to pick up the virus when out. That fear of not having enough masks for our nurses and our doctors and our healthcare workers, not enough capacity in hospital beds and ventilators, that's been addressed with better supply chains, with better surge capacity plans, and also through the prevention that each one of us has done. The uncertainty that was there about how long will this pandemic last has really given way to recognition that we are living with this virus for the coming months, year, or even more. And we know during this period of time that the virus has caused extreme hardship to some, loss of work, loss of businesses in families. There's been a lot of stress. And so we are now, with resolve and determination, I think, facing that we need to continue with opening schools, with getting people back and employed as much as possible, and with continuing social supports. And so I think the last thing I want to highlight we've learned is that social connections are so important to us, and that it's not sustainable to be able to think about older adults having to be isolated for long periods of time. And so, what we know is as those social connections are so important, it is still important also to keep them limited in number, and that this is really the time to invest in the relationships with people that are closest to us. Il est toujours aussi important de maintenir nos cercles sociaux au minimum et de s'investir dans nos relations les plus proches. I am hopeful with our COVID-wise actions in place that we're limiting community transmission, and that we will come through this next 6 months stronger together. At this point, we have another week of school reopening under our belt, and Ottawa Public Health's COVID response team, the school support team, continues. We're working with all 4 of our school boards to support a safer return to school. And unfortunately, we do see that we have had individuals who have worked or attended schools test positive for COVID-19. However, to date, there have been no outbreaks in schools because these, were people who were exposed in the community. Nous soulignons qu'à date, nous n'avons pas déclaré d'éclosion dans les écoles, puisque la transmission du virus a eu lieu dans la communauté et non dans les écoles. Our case management team, and I'll come back to that word case in a minute. I think we're looking for a new name for the team, but for now, our case management team is working hard to reach individuals who test positive and then their close contacts to ensure that everybody knows the next steps that they need to take. We're working with the school boards to ensure, again, that protocols are clear for assigned seating on buses so that entire busloads of students do not have to be isolated because of a potential exposure. And I do want to make it very clear, if someone in your household has symptoms that could be COVID-19, all members of the household who were in close contact must stay home until that person tests negative or 14 days have passed. And in cases like this, the whole family does not need to be tested. This is an added precaution in Ottawa, given our level of community transmission that will help to keep COVID-19 out of schools. Je tiens à être clair. Si un membre de votre foyer a des symptômes qui pourraient être COVID-19, tous les contacts étroits dans le foyer doivent rester à la maison jusqu'à un test de dépistage négatif ou que 14 jours de se soient écoulés. Et toute la famille n'a pas besoin de se faire dépister dans ce cas. The daily screening is another important way we can make school safer for children, for the youth that are there, for staff. Parents and students can use our COVID-19 screening tool for students, which is available in 7 languages. It's part of a good morning routine. Le dépistage quotidien des enfants est un autre moyen important de garder nos écoles en sécurité. Je m'excuse. Ajoutez à votre routine matinale de dépistage de la COVID-19 à l'aide de l'outil disponible en 7 langues sur notre site web. And speaking of routines, we've received questions about precautions that students and school staff can take when they return home from school. So what's most important is washing your hands and cleaning properly, disposing of your masks that you are wearing. And we do have more information about cleaning masks on our website. You can leave your shoes at the door and wash or disinfect high-touch surfaces like doorknobs, countertops, faucets, light switches, lunch boxes. And this isn't a one-way conversation. It feels like it often as I'm speaking to the camera and not real people, but we do continue to welcome feedback from residents about how COVID-19 is affecting your life, including the long-term aspirations and how you are living with the virus. So visit engage.ottawa.ca to have your say. Your feedback does continue to help us develop recovery plans and help us to work with community partners to address the needs that exist. So I'm going to come back to that word case. The COVID pandemic has caused a rise in stigma and prejudice against people who have the virus. The stigma can often provoke discriminatory behaviors because of a perceived link with the disease. And so Ottawa Public Health has developed a position statement on stigma and COVID-19 to address stigma and prejudice in our community against those who have the COVID-19 virus. And people who are thought to be carriers of the virus based on their appearance, and people who are thought to be from areas where COVID-19 originated. La pandémie de la COVID-19 a mené à une hausse de la stigmatisation et des préjugés envers les gens qui ont le virus. Santé publique Ottawa a mis en ligne une déclaration de position sur la stigmatisation et la COVID-19. Et cette déclaration contient plusieurs suggestions sur la manière dont nous pouvons tous contribuer à réduire la stigmatisation dans notre communauté. So some solutions include using person-first language. Instead of referring to a COVID case, as I know I have done, we are working to say an individual who has tested positive for COVID-19. We can speak positively and recognize the reasons people test positive for COVID-19 are often beyond their control. People's need to work and their inability to self-isolate can increase their risk of exposure. So we need to point people to supports that exist, and we need to correct myths and rumors and stereotypes. More ideas can be found within our statement, which is available on our website. So let's work together to keep our community free from stigma. Le point clé, c'est que on veut utiliser la phrase comme une personne avec un résultat positif pour COVID-19, pas le mot cas, quand c'est vraiment une personne qui a le virus, et ça peut aider avec de réduire la stigmatisation. So as always, I encourage everyone to check regularly on your own mental health. It is okay to not be okay. We need to talk to people about how we're doing. Know that you're not alone. Physical activity helps getting outdoors. And we do have, again, always on our resource, more links to get the support that you need for mental health. Thank you, our media partners. I haven't said this for a while, but really you are key to getting the messages out there. Communications is one of the biggest tools we have to help with reducing transmission in our community. Merci à vous, nos partenaires de médias, de nous aider à disséminer notre message. Jusqu'à s'il y ait un vaccin ou un traitement contre la COVID-19, les communications sont l'un des meilleurs outils pour aider à maintenir la transmission de la COVID-19 à un faible niveau dans la communauté. So thank you, Miigwech.
Thank you, Dr. Etches. In the interest of time, I will read through the list of media who've registered today. You don't need to mention that you are present. However, if I've missed your outlet, please speak up after I'm through the list. Vous n'avez pas besoin d'indiquer si vous êtes présent, sauf si je n'ai pas nommé votre agence. Today we have 1310 News, Cbc News Ottawa, CTV Ottawa, Global News, Le Droit, Ottawa Citizen, and Radio-Canada. Have I missed an agency? Est-ce que j'ai manqué quelqu'un? I will now invite each agency in alphabetical order to ask their question. Please remember you have just one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique. Chacun pourra poser une question et une question de suivi. So the first one up, I believe we have Jason White from 1310 News. Please go ahead, Jason.
Sorry, I had to find my mute button. Sorry about that. So my question, Dr. Etches, is can you tell me a little bit more about you touched on going over the importance of doing the things we're supposed to do with the school bus operators and school boards and that sort of stuff. Can you tell me a little bit more about what's been involved in that in this first week as really almost everybody or just about everybody's been back to school, who's going to school? What has that involved? What has been needed to go over the importance of proper protocols and why that's so important to prevent COVID spread with the school bus operators and the school boards in particular?
I was muted. Certainly, the first thing we are working with the school boards and schools to make sure is that they are promoting our screening tool on our website so that people who have a reason to stay out of school, and that is as useful. Our nurses are talking with principals, are observing things in the schools and problem solving. So they're getting questions from principals about, what should I do if I received hand sanitizer and there was no pump, and like practical problem solving is happening on the ground. I think one of the things we see too is that the lineups when picking up and dropping off students have needed more active management. So of course, right, these are all the first time somebody's tried to have pickups and drop-offs in a time of COVID and finding ways to space that out and make sure there's distancing. I would say to the population of parents and guardians that are doing that work to also consider, wearing a mask if you're in close contact with others, even outdoors when you're waiting to pick up children. These things don't hurt, they can help. And so the other kinds of things you asked about were on the school buses, and that is where there were always plans to have assigned seats on school buses, but now school boards, the bus transportation authorities are making sure there's a way to confirm that students did sit in their assigned seats. And again, it's not surprising we have to teach young children, especially a new thing, which is their seat, and that's their seat. But we do expect that that is something that will sink in, that will be feasible to maintain for the school year.
Thank you. Just following up on the back to school issue, we found out today from the Ottawa Student Transportation Authority that 2,300 some students won't have school bus service on Monday. Is there any messaging you have for parents or guidance or any concerns that you have now that those students are going from having an assigned seat on a bus with increased cleaning and all that sort of stuff to finding their own way to school, to walking in groups, getting a ride part way, or possibly carpooling? Is there anything you would like to say to parents around that now that we know that these 2,300 or so students won't have school bus transportation on Monday?
Well, of course, I want to acknowledge that sounds very difficult. We are really missing core supports in our community related to how schools usually operate. So it is a challenge. What I would recommend is going back to the basics in terms of adding in layers of protection. So if someone is walking or biking to school, injury prevention is important. But that that is a good option if it's possible, given the distance that children and youth need to go. If having to take a shared vehicle, then keeping the windows open, wearing masks in the vehicle is another layer of protection. If on public transit, of course, masks are mandatory for that reason. They help. Keeping hands clean, so it is going back to the basics. These are all additional measures that will help.
Thank you, Doctor.
Thank you. We'll now take questions from CBC News Ottawa. Ryan Jones, the floor is yours.
Thank you very much for taking my question. Can you hear me?
Yes. Yeah.
Great. Yeah, so I just was hoping, Doctor, if you could elaborate a little bit more on how concerned you are that, a week into school, we have 6 schools where either a staff or student has tested positive, and what we can expect in the coming days and weeks.
So I'm not surprised because we did see every day, and we continue to see every day, school-age children who are testing positive for COVID-19. And the goal is to make sure that those children or staff don't come to school when they have symptoms and they're waiting for a test result, or of course if they have a test result. So I think we can underline that, we can emphasize that we have, and that's a practice that everyone is emphasizing across the school system that will make a difference. What we want to avoid is transmission within the schools, and we haven't seen that yet, although that can happen. This virus is a tricky one, right? Where we know there's times people don't realize that they have the virus, and it can be brought in. So we're going to keep learning and observing and reporting on what we're seeing. The numbers on the Ministry of Education website will not always tell the whole story, because I think there was a 6th school posted, but that wasn't someone who was actually a source of exposure to any students in the school. So I think that what Ottawa Public Health will be reporting on is the outbreaks. If we have any outbreaks in school, they will be on our webpage where other outbreaks are listed. So it's on our dashboard, and so far we don't have any.
Okay, and just a follow up on assigned seating. You kind of touched it on an earlier. Sorry, assigned seating on buses. Are schools being mandated to assign seatings, and is it happening across the city? And is this an OPH mandate?
I know that all the school boards are working on assigned seating. I'm sorry, I can't be 100% sure if the mandate comes from the Ministry of Education, but it is highly recommended by Public Health, and it's being implemented, across the city, all school boards.
Thank you.
Thank you. Our next question will be from CTV Ottawa. I believe we have Michael Woods on the line.
Hi, Dr. Edges. Thank you for taking our questions today. You alluded to it just now, but I wanted to ask you about the 6th school that had a positive case, in this case, a staff member, according to the provincial release this morning, data release. Has anyone at De La Salle School have any other students or staff needed to isolate as a result of this case?
Right, so this was a situation where there were no students exposed, and I believe there were less than 5 people in the school community who did need to self-isolate as a result.
Okay, good. Thanks. And unrelated follow-up, just on the stigma issue that you were talking about and the position statement from public health, the word case sort of being an issue. What specific reports have you had as a public health agency of sort of incidents of stigma in the community here? And do you find that it's improving, or is it getting worse, or is it kind of the same? Like, I know there were a lot of reports, not just locally, but all kinds of places in March and April. I'm just wondering if it's improving at all, or just where you see the status of that and why you decided to put out this position paper now.
No, I can't really give you solid evidence of a trend. I would need to go back to our community partners who are on the ground working with communities more affected to understand if there's a trend of, I think there's just, it continues that we get qualitative information about how people feel they're being treated and judged. And we do know that this idea of being a source of infection, a case, can be harmful. It's not how we want to view people. We want to view people as people. So there isn't a particular trigger for this position statement, except us realizing that we ourselves can do better, and we're going to commit to that, so that we aren't adding to the language that makes people feel that there's something wrong with them, or it's about blame. This is not the case. This is a virus that is all over the community, in every neighborhood, and we all need to to support each other through this pandemic.
Great, thank you.
Thank you. Our next questions will be from Global News, and I believe Craig Lord is on the line. Craig, the floor is yours.
Thanks very much. Dr. Etches, you were talking earlier about how we're 6 months into the pandemic and a lot of our original fears have been countered at this point, but I'm wondering at this milestone, where do you still see the weaknesses in Ottawa's response to the pandemic? Where do we need to shore up our response and as a community work a little bit harder to keep this virus pinned down?
Thank you for the question. I'm going to start in my territory, or my area of responsibility. I think is what I can speak to the best. To say that in public health, we're always interested in prevention. That's the most cost-effective way to go. If we can stop the infection from happening, and we don't have to spend money on testing, contact tracing. And so I do think that as an organization, Ottawa Public Health is trying to squeeze out some capacity and reorient to be able to work with communities where we see there may be more that could be done to prevent ongoing transmission. More in terms of understanding what the barriers are for people to be able to be COVID-wise, to have physical distancing, to access masks, to be able to stay home when you're sick. So this is important, and I think it can grow, and it will help overall.
Great. I was wondering, we've been hearing a little bit this week about various cities and across the province, what's going to happen at Halloween. Just wondering if you have any thoughts about how to most safely handle October 31st this year.
Sure. I think there's a lot of fun to be had still with Halloween. There's a lot of dressing up and treats that can be, done and handled in a safer way. So it really is about going back to the basics where if there's distance between people, that's great, 2 meters. If it's outdoors, or if people are wearing masks indoors, I'm sure we'll get questions about what kind of Halloween masks are protective against COVID-19. So I know there are more questions out there about specifics. So we will be putting together some more guidance for people. The province is actually working on this, and so I'm sure we'll be aligned with what their recommendations are. But it really is about going back to the basics. That will always help. These COVID-wise behaviors are what's keeping the level of infection manageable.
Thanks, Dr. Etches.
Thank you. La prochaine question viendra de Le Droit. Catherine Maurras, c'est à vous.
Bonjour. Cette semaine, du côté du Québec, il y a une confusion. Il y a une liste qui a dit possiblement par erreur qu'il y avait des cas dans 10 écoles en Outaouais. Je vous ramène sur les 6 écoles qui auraient des cas à Ottawa. Est-ce que vous craignez qu'il pourrait y avoir une confusion semblable?
Je pense que peut-être j'ai besoin de l'aide avec de comprendre la question. Vous avez 6 écoles aussi à Outaouais avec des...
Non, en fait, c'est cette semaine des statistiques qui sont sorties sur les écoles en Outaouais et en fait, le gouvernement finit par supprimer la liste s'il y avait potentiellement des erreurs là-dedans et voilà, ça crée de la confusion. Donc, ma question, c'est est-ce que vous craignez qu'il pourrait aussi avoir une confusion semblable autour des statistiques dans les écoles?
OK, je comprends. Oui, c'était difficile d'avoir une liste, confiance dans la liste des écoles avec différentes situations. Est-ce que nous avons le même défi ici? On verra. C'est possible, c'est nouveau. Je voudrais peut-être expliquer encore que c'est possible d'avoir des conclusions avec les normes sur le site pour les parents concernant les situations dans les écoles qui est créé par le ministre de l'Éducation parce qu'il compte peut-être les infections dans les étudiants ou les employés où il n'y a pas un risque aux autres. Et pour Santé publique Ottawa, c'est notre priorité d'identifier où il y a un risque aux autres et il y a besoin de demander que quelqu'un reste chez eux et ne participe pas à l'école. Alors, c'est possible qu'il y ait une différence dans la perception de risque. Aussi, je pense que c'est différent d'avoir une infection et une éclosion. Et c'est les éclosions qui aussi sont plus importantes pour la santé publique parce que ça démontre que peut-être les processus pour le contrôle des maladies dans les écoles ont besoin d'améliorer. Alors, ça c'est les différences, mais je ne sais pas si c'est une erreur dans le compte, c'est juste l'interprétation qui est différente.
Est-ce que Santé publique Ottawa pourrait prendre des mesures pour justement éviter une confusion semblable?
Je pense que c'est juste d'écrire, il y a une différence entre les deux situations. Quand il y a une personne qui a un dépistage positif et quand il y a une éclosion. Et pour les parents, s'ils ont besoin d'être informés qu'il y a une exposition concernant leur enfant, leur jeune étudiant, on va communiquer directement avec les parents. Ça c'est clair. Et nous avons beaucoup d'informations sur notre site web pour expliquer le processus en plus de détails.
Merci. Merci. Alors, on passe. We're now moving to the Ottawa Citizen with Taylor Blewett. Taylor, the floor is yours.
Thanks so much. I just want to go back to the topic of Halloween and trick-or-treating. I know for some reason it's been something we've been getting like a lot of questions about or having lots of discussion about. Specifically on the question of trick-or-treating, Dr. Etches, do you anticipate that this is something that will be allowed come October 31st? Will this be a provincial kind of decision or any kind of instruction issued there? And I guess what would you tell families who are like very much hoping they can continue with that tradition in some capacity this Halloween?
Lots of points there. I guess the first thing is that rules and regulations are not what's helping us manage the pandemic, right? What's allowed, what's not allowed. That's not really what's giving us success in the end. What's giving us success is that people are keeping 2 meters distance from each other, that they're wearing a mask when they're indoors, that they're staying home when they're sick, and they're washing their hands. So that's how we should approach Halloween. We should use those same behaviors. And so how do you adapt then and be creative when it comes to Halloween so that you can do it in a COVID-wise way? I think the province is going to come out with some guidance, some recommendations, and I'm sure that will be good guidance, and we'll follow that as well. But when it comes down to it, each of us doing our part, making decisions about how to care for one another, just as we have been, and of course, trying to have some fun, right? Because it's fun to dress up, and it's fun for the kids to have treats they might not always have, and so we need those things in our lives too. So again, just going right back to being COVID wise is the way to approach it.
Thanks. And a different topic, listening to the council meeting earlier this week, I heard a lot of councillors bring up concerns with access to testing. Is it your sense that there are a lot of people in the Ottawa community who could be, I guess, are in a position where testing would be recommended, but they are not going to seek that out because they're facing barriers, whether that's mobility or transportation or other issues accessing testing? And is that something that concerns you?
We're always interested in making sure that the people who need to be tested for COVID-19 because they have respiratory symptoms or they're a close contact of somebody who's tested positive for COVID-19, we want those people to have access to testing. And so we probably have more people that are going for testing who don't really have those risk factors, than people who are not going because of barriers. Our experience has been that the number of people who are asymptomatic showing up for testing is very high. And our priority is symptomatic people, people who are close contacts where there's been an exposure. The work continues to increase points of access. We know the number of centers will continue to grow. Also, our partners in the regular healthcare system, our primary care partners have a role to play. And so if somebody's having barriers accessing testing, we'd encourage them to reach out. We can help problem solve. Our hospital partners do have a mobile service that is available by referral through your healthcare provider. So I think that, I guess the point to underline is we may have more testing happening than is even needed, given that asymptomatic testing is not always that useful. And we want to make sure that people who have symptoms and are close contacts, that they're prioritized.
Thanks.
Thank you. Finalement, la question, on va passer à Radio-Canada. Jérôme Bergeron-Sassier, je crois que c'est vous.
C'est moi. Bonjour.
Allez-y.
Bonjour, Madame Etchès. J'ai une petite question pour vous. D'abord, d'entrée de jeu, vous avez parlé du 6 mois là, de la pandémie. 6 mois plus tard, on ne se pose pas les mêmes questions. On avait beaucoup d'enjeux sur l'approvisionnement matériel. Est-ce que vous pouvez nous répéter un peu tout ça en français? Là, 6 mois plus tard, quel bilan vous en tirez? Est-ce que ça va mieux et est-ce qu'on doit encore avoir des inquiétudes?
Oui, aux comparaisons de le début de la pandémie à Ottawa, et aussi, je peux dire c'est plus que 6 mois que notre équipe est vraiment active de combattre la pandémie, mais c'est 6 mois pendant le premier, depuis, excusez, le premier infection qui a été identifiée ici. Nous avons moins de peur parce qu'on a plus d'informations, qu'il y a des actions qu'on peut faire pour éviter la transmission de la COVID-19. Alors ça, c'est bon. Aussi, on a plus d'options pour acheter les masques. Ça, c'est important. Notre hôpital a des plans pour plus de capacité et on a une population qui a l'habilité, la capacité de faire les actions pour prévenir un nombre des infections trop haut. Alors, ça, c'est vraiment une bonne nouvelle. Les inquiétudes qu'on continue d'avoir la possibilité d'une augmentation dans le niveau de maladie dans notre communauté tout le temps. C'est difficile de continuer avec les limites sur le nombre de contacts et j'imagine la pression avec la grippe qui va arriver. Mais je pense que nous avons les outils, les actions qui peuvent faire la différence de continuer de vivre et retourner à l'école, les autres activités importantes, l'emploi pour l'avenir.
Et comme dernière question avant ce long week-end, j'aimerais savoir, vous avez déjà eu comme opinion, vous avez dit, dès qu'un enfant a le nez qui coule, on doit garder cet enfant à la maison pour ce qui est de la garderie de l'école. Au Québec, on doit jumeler là, ce symptôme-là avec un deuxième. Alors, il y a plusieurs parents qui se disent, on n'a pas l'impression qu'on va avoir un long automne, un long hiver. Il va falloir constamment aller faire des tests parce qu'il y a tout le temps des nez qui coulent 1 fois ou 3 semaines. Qu'est-ce que vous répondez à ces parents-là qui trouvent que ça n'a pas de bon sens?
Oui, c'est difficile d'imaginer un automne avec plus de temps avec les enfants quand on a besoin de travailler. Ça, c'est difficile. Mais j'espère que notre action peut diminuer le nombre de journées avec un nez qui coule. Parce que quand on lave les mains, quand on garde la distance, ça diminue la possibilité de transmission des autres virus. Aussi, c'est un temps pour faire les précautions pour le début de l'école, de voir qu'est-ce qui se passe et d'apprendre si il y a beaucoup de différents virus dans la communauté, est-ce que c'est COVID-19 ou non. Alors, on va partager l'information sur la situation si c'est possible de changer notre approche, mais pour maintenant, c'est vraiment important. Si il y a un enfant avec un nez qui coule, c'est possible que c'est COVID-19 et il faut identifier COVID-19 si c'est là. Mais si c'est un symptôme qui continue, c'est aussi quelque chose on peut discuter avec votre médecin famille parce que c'est possible qu'il y a quelque chose d'autre qui se passe si c'est long et on peut avoir l'avis d'un clinicien.
Merci.
De rien.
Et ceci conclut le point de presse aujourd'hui. That's all the time we have for today. Happy Friday, everyone. Thank you very much.